Hello, my name is Lindsay Shuck. Thank you for joining today's Family Office Network's webinar series featuring OXIO Health, Inc. I would like to take a minute to introduce our three speakers today. First with us is Noel Guillama, president of OXIO Health, Inc. Noel began his career in the family construction business and then became an angel investor in healthcare and switched his career to acquisition and management for medical practices. He designed an electronic health record and is co-inventor of 40 patents in healthcare and has taken 6 companies to public market, including 2 via IPO. Carl Larsen, Executive Vice President and COO, is also with us today. Carl has over 35 years of engineering and construction, owning as well as managing small and large startup organizations, with upwards of 30 million in revenue and more than 350 employees in engineering and construction. He has 20 years of experience building and managing software development teams and more than 11 years in the healthcare industry. Lastly, Gregg Steinberg, outside board member and vice chair. Gregg is currently the CEO of Greenway DNA, a DNA testing solutions provider. Gregg was president of an early stage company that under his watch generated more than $2 billion in organic revenue, grew to over 2,000 employees, and was in the top 10 of the INC 500 for 2 consecutive years. Gregg has been at the board and operating level in healthcare for over 15 years. At the end of today's presentation, we will have time for Q&A. We encourage you to send over your questions at any point using your questions chat option on your screen.
Thank you, Lindsay. Appreciate everyone in attendance. While you lead the normal disclaimer information, I will tell you our 60-second pitch that I was taught was really important when talking to potential investors. We bring 30 years of experience in healthcare, combining physical assets, medical operations, and technology to transform the experience of the consumers, the provider, and the technology-infused care. The first $500 million is going to be easy. The rest will take a little work. As we succeed, we will empower the patient, enable the provider, and advance the science. We bring comprehensive solutions to a complex systems that includes actual customer care, innovative physical locations, and end-to-end technology. To investors, we bring a new model that is built to continue to create value and then reward them along the way. So part of the presentation will be split in 3. I will be speaking about the general state of healthcare and the opportunity. Carl will discuss the 5 individual companies, and Gregg will discuss the financials of the company going forward. If you have noticed the headlines, besides the COVID crisis that we're all living through, one of the biggest challenges we have seen is basically the failure of the healthcare delivery system to handle this epidemic. Literally at every level, the hospitals, the providers, and this has provided an opportunity for a company like us. We were already in development. We were already planning to come forward, but the opportunity is now much bigger and also at the right time, at the right place. Healthcare in the United States is a little bit over $3.5 trillion industry. We believe the future is based around 2 things. One is a fundamental change in the structure of how healthcare is paid and how it's provided. And the second is in a way of infusing technology into healthcare is fundamental. A couple of years ago, we were all witness to a headline where 3 of one of the most respected and largest companies in America said they were going to come together and they were going to help transform healthcare. We were very dubious because it has been tried before. And the hard thing about healthcare is that you cannot change healthcare with sort of what I say, getting your hands dirty, or effectively helping provide the care. We basically said that group purchasing organizations have been around for over 75 years, and you had to create an environment where you brought in technology and physical solutions in the actual delivery of care. And the problem is very big because not only in responding to the current pandemic, but Medicare, for example, is expected to double in revenues or in costs over the next decade. So we believe that over the next 10 years, healthcare will be transformed materially. We now think that it will be faster because of what's happened with COVID. So we will look at how to change the structure, transitioning from fee for service to value based care, and bringing in that technology infused care where you aggregate not only the patient's records, but also the Internet of Things devices and remote care, which is really much more than just telemedicine, as Carl will talk about later. We've designed a state of the art EHR platform. We have received a license for 21 patents, 18 additional patents that are pending. Plus, we've created a very innovative way to reward our investors by also distributing the value that we create in these companies going forward. So we believe, in fact, it's sort of a new asset class. Originally, the company was founded as an R&D subsidiary to create this electronic medical record that we've created and now have received a patent for. The idea was to bring together technology in a very practical way. Literally in January, right before the pandemic, we changed the company's name to OXIO Health and updated our vision beyond technology to literally providing the care and integrating the care in a much more holistic solution, as you will see Carl explain in a few minutes. And we believe that the reason why technology has not made a dramatic change in healthcare is because it really hasn't been infused. You've had providers of care looking for technology. You've had technology companies looking for providers or customers instead of looking at it as one combined ecosystem. The opportunity is what we have created. We've created basically a platform of companies. We're starting with 5 companies that Carl will go into detail. We're starting with 3 captive companies that are designed to provide services with a single philosophy going forward, as we said, to change and empower the patients, to enable the providers, and to advance the science of healthcare. That's the only way we're going to be able to change. We borrowed a line from William Shakespeare in what is past his prologue, and we'll talk to you a little bit about the sort of the 3 acts that we call it, which is the experience that we have bringing to the table that's not theoretical, that literally means operating medical centers, diagnostic centers, operating healthcare delivery system, managed care, helping with the organization of 2 medical schools, extensive experience in construction and real estate property management, and literally physical operations in medical and in other ways. In technology, we've created multiple platforms, from the idea of creating literally a middleware to existing off-the-shelf platform to designing a now innovative, patented platform that has received government certification twice, and it created other platforms, including a CRM platform. And our goal now is to bring in the development of these platforms in-house versus what we have outside. On the financial side, we've got tremendous experience, not only in taking companies public, not only in acquiring dozens of medical practice, literally taking companies from startup to $100 million, $200 million, even $1 billion. And one of the most interesting things is I've had the honor and the pleasure of being on the investment committee of 2 universities that has taught me how successful venture capital have been generally, and sometimes how challenged they have been in healthcare. So we're trying to take some of the best models in that venture world, but applying it only in healthcare and only in healthcare companies that we know are needed today. We've also managed some very large companies, as you heard, that have been literally, in the Inc. 500. A lot of experience in disaster management. So we're not sort of intimidated by this current circumstances, where it really is an opportunity because doctors right now are in serious crisis. And we'll talk a little bit about that. So that's our background to what we have. We discuss here the 20, now 21 patents that we have licensed in an array of data analytics, behavior management, EHR, and even a couple in augmented reality and blockchain. So we have seen, and we believe, sort of a new way to imagine how healthcare is going to be provided. And that's fundamental. So the problem number 1 has to do with the poor patient experience, how doctors are rewarded, are paid. What we say is an obsolete transaction model. The more a doctor sees a patient historically, the more they get paid. We have seen and witnessed the collapse of literally physician practices over the last couple of months. Some have lost 70, 80, 90%. Some of that is coming back, but generally in the elderly population, and we can talk about that. We also have seen that uh, that we've had a concentration of specialists in hospitals, and that has had an impact on costs and actually transparency of care. What we think is missing, fundamentally missing, and we'll say it over again, so hopefully you'll bear with us, is that in technology-infused care. You could not separate technology from healthcare in the future, and we have the experience to bring it forward. We also know for a fact that because of the aging demographics, healthcare as a percentage of the GDP is going to continue to grow. We are looking to provide a comprehensive solution that changes the patient experience, that changes the way doctor gets paid, that creates a unified medical record for the patient. And we use that to both reduce the cost, or in our case, increase the profitability, and to enhance the patient experience. By the way, also making the doctor's life a little bit better. Some of us have witnessed what has happened with the infusion of over $100 billion into EMR over the last decade. It was a good idea. It was well thought. Even I believed it for a while. But what has happened, we've created now deeper and longer silos of technology. And literally, Fortune magazine a few weeks ago came out with a report is how bad this experience has been. In fact, it is one of the leading contributions to physician burnout in the United States. We believe that we have to have a comprehensive data-driven solution so that, again, the EMR and the data that is received from the patient is integrated into the medical record, and it's not one company versus another. There is no competition here between the provider of care and the technology solution, because in fact, our technology operations are going to be initially a captive of our own delivery system. So we believe that that is fundamental to how we transform healthcare, or as we said in the title of this webinar, is fixing healthcare for the future. The third opportunity, it's probably what we should have said, is really that the material amount of money has been made in startups by venture capital firms that have funded companies into the seed round, the A round, the B round, the C round, the D round, the E, F, G, H, I, and then eventually those companies get taken public. And as you see here, PitchBook has basically said that VC-backed IPOs as of literally the first quarter of 2020 did not do very well. And in healthcare, I can tell you the record is even worse. So our idea is innovative, and that idea is to distribute these companies to our shareholders via a dividend, so that as we eventually sell these companies, and we'll talk about later, as we potentially take these other companies public, it's not just a parent that's making the money on an aggregate basis, but it's also the individual shareholders. So it's a little bit of a bridge between an incubator, a venture capital, accelerator, and even private equity. We see tremendous opportunity, not only in the enterprise, but also in creating liquidity for our shareholders in more than one method. So if you look at it, this is really one company, one philosophy with sort of different buckets. And now I'm going to hand it over to Carl, who will tell you a little bit about these buckets and the critical role they play, both to each other and to our success as an enterprise.
All right. Well, thank you, Noel. I appreciate that. I want to kind of pick up where Noel left off a little bit and talk about the pandemic, quarantine, and the impact that it's had on the primary care practices. Primary care in the United States is our community-based points of care. That's where the population is truly served, and they have been devastated. And one of the reasons they've been devastated goes back to the comment Noel made about the transaction and payment system. The difference between a fee-for-service, which is encounter-based, and a managed care model. Because of the encounter base, when a quarantine was initiated, primary care practices were no longer seeing patients, so they were no longer collecting revenue. Result of that is that 20% of the primary care physicians across the United States have reported that they are planning on or very seriously considering closing permanently. 55% of our primary care practices report they're not prepared at all for the next pandemic, should one come, and that may very well happen because we know that pandemics come roughly every 10 years. 76% report they are at or near a severe stress level. And that's our primary care practices, but what's been the impact into our population? Well, into the population, because the primary care practices were closed, Kaiser Family Foundation surveyed about 2 million members within their program, and 48% of those 2 million reported that either they or someone they knew very closely had postponed care. And of that 48%, 11% reported that their condition had worsened. This delayed care is resulting in a rebound because many of these patients whose condition has worsened are no longer able to see their primary care physician because their case has exceeded what the primary care physician can provide. And so they are now having to go into the emergency rooms or they're having to go into the hospitals, which is causing a significant increase in healthcare costs, not to mention the fact the primary care physician is still not getting any revenue. So what I want to do is talk about, as Noel said, these 5 companies that we have. I want to draw your attention very quickly to the 3, as we've captioned them, our captive companies, our healthcare construction services, our administrative services, and our technology services. What we're doing is creating economies of scale because construction services will be greatly, and you will see shortly, involved in our care work clinics, but will also be involved with total care and power. The technology company is essentially our building our own in-house development team because we have 3 healthcare IT companies that you see on the bottom, and that's only today. We could have other healthcare IT companies coming along in the future, but also we're going to be infusing that technology into total care and to care work. So those 3 captive companies are very important. Administrative services is very clear. Obviously, all 5 of those companies need to have a level of administration, finance and accounting, payroll, and so on. So all of those being subsumed into those 3 companies creates, we believe, tremendous economies of scale and provides those 5 companies the ability to operate in a much more streamlined fashion. So I want to move and discuss total care and care work clinics. Our total care company is a company that will contract with an insurance company and participate with a provider in patient care management. They will be implementing, as I said, our IT companies to increase the quality and consistency of the care provided to these patients. These patients will be essentially the Medicare Advantage patients, and you can see by this graph how quickly those numbers are growing. 10,000 Americans are reaching the age of 65 daily, and approximately 35 to 45% of those are enrolling in Medicare Advantage, which means that we have a growing consumer base on a consistent basis. This 10,000 that are reaching the age of 65 daily will continue for the estimated 9 years to come. So this is not our first attempt in total care. Experience goes back to Medcare, and that company, which Noel started, had grown to almost 140,000 or 140 million in actual revenue in a period of about 4 years. So this, you can see that the hockey stick graph, and this is exactly what we will see with total care. We expect, based on this experience and other experience as well, because Medcare is not the only, we call it an MSO for Management Services Organization, that we have done. And based on those experiences, we expect over 8,000 plus in annualized recurring revenue per patient per year. So, as I said, this is a very, will be a very, very strong company, and we will be embedding our technology in it to make things even better. The next company I want to address with you is CareWork Clinics. This is our real estate healthcare facilities company. Will be, as you can see in the lower right-hand corner, you can see the photographs. These are existing companies or buildings right now in our area within a 10-mile radius of one another. And these are shut down and empty Walgreens pharmacies, CVS pharmacies, Rite Aid pharmacies. And so our business model with CareWork is to purchase these and then remodel them and create the care capability for physicians to see their patients, totally managing the back end for the doctor and relieving them of all of that business headache that they have now, in addition to making the total care physicians anchor tenants within these locations. The beauty of this truly is that a physician can actually expand their practice by leasing with us, and then in Florida and a couple of other states, they can actually have a nurse practitioner working in other locations, seeing other patients, which provides additional revenue and expands the practice. What's driving a lot of physicians is the financial pressure. And as Noel said, we had this concept in planning before the pandemic came along. The financial pressure, as you've already seen, is even now driving some of the primary care physicians out of practice. So we have a tremendous opportunity to help rebuild our community-based care and provide longevity to these physicians who now are in desperate need of being able to continue their practice. The next thing I want to do is now move to our healthcare information technology companies. These three companies and are both consumer facing and as well as integrated within our total ecosystem model that we have. So they bring a tremendous value proposition being integrated with this ecosystem far more than they would independently on their own. So I want to start with our first company. We call it PWER, PWER, which stands for Personal Wellness Electronic Record. We've already invested more than $8 million in this electronic health record program that provides, in addition to just the basic electronic health record, practice management, disease management, patient billing, and the ability to connect to labs like Quest or over 1,000 different pharmacies in the United States. We were evaluated in 2018 and ranked in the top 10 of all EMRs and EHRs. In addition, we will be upgrading the platform in this fall to the newer and required mandated standards that will allow us the opportunity to increase the range of the program by adding a communication package that will include telemedicine, encrypted chat and audio, and some other important features. The Power platform has also been certified and is as you can see, by the Department of Health and Human Services Centers for Medicare and Medicaid Services, their independent auditing and certification arm, which is the Office of the National Coordinator for Health IT. This is a very important feature because it is what validates power as a legitimate EHR to be used by physicians. And at one time, there was actually a penalty to a physician if they were not using a certified electronic health record or electronic medical record program. One of the key features that is now supported by the patent that Noel mentioned is the ability to simultaneously view a patient's record, a single patient's record, by multiple physicians at the same time. This is not anything we're aware that anyone else can do, and provides a tremendous opportunity for collaboration. When we add telemedicine to this, it will be have an even greater advantage and allow tremendous increase in both the quality and speed and accuracy of patient care. The next company I want to discuss is our blockchain, PWBR, the Personal Wellness Blockchain Record. You'll note our focus is not just on health, but it's on the whole person. And that's why we've named these companies Personal Wellness, not Personal Health. The difference between PWBR and PWER is more than just the acronym. PWER, our power EHR that I just discussed, is a provider-centric platform. PWBR will be patient-centric. And by that I mean the patient will have full authority over granting access to individuals who can view their medical record. In addition, PWBR is designed to have medical record information and data that the patient has available to academic and pharmaceutical and other research at the approval of the patient or the consumer. So we're looking forward to PWBR advancing significantly the science of wellness and healthcare. The program will embody both artificial intelligence, advanced data analytics, and a significant amount of predictive medicine. It empowers the consumer, and our goal is threefold, and you'll hear this again, to empower the consumer, to enable the provider, and advance the science. And PWBR provides that capability. Blue Box is our next company. We call it Blue Box Care. And it is our Internet of Things company. It is the company that will reach out, collect, analyze, and integrate wearable device data into our EHR and our blockchain personal wellness record program. This is a extraordinarily fast-growing area, and I can tell you, you can't see on my arms, but I am guinea pig for about 3 different wearable devices right now, just to be able to understand and know and collect the data. The Blue Box is significant to our one patient total connectivity strategy, and as you can see, the number of wearable devices is growing at the rate of about 20% per year. That's significant. And frankly, I fully suspect that this will grow much more rapidly as a result of this pandemic, realizing the need to be able to provide distant care or remote care with patients. It's now becoming a very important thing, and I'm sure you have read about it. It's on the front burner for a lot of things, and telemedicine is going to be an important element of that. I want to just take a moment now and kind of bring together one area in which all of this comes together. It's not the only area, because this is not really the only use case for the companies, but is just one of many. And that is combining telemedicine, the active remote monitoring that is provided through Blue Box, and a universal EHR like PWER, Power, our personal wellness electronic record. And we believe that forms what we're calling a golden triangle of care that will help a provider manage at-risk patients at home, would allow a hospital to early, and I won't say discharge, but move patients from an ICU environment to a step-down unit, as they call it, and still be able to fully monitor that patient in the hospital or even at home. And eventually, we envision what we're calling a smart home. That's not our term. A lot of people are using that. But what we mean by that is an individual that can live in their own home, a senior perhaps, living in their own home instead of having to go to a nursing home for care and be fully monitored all the way down to their compliance with the medications that they take on a daily basis. This integrates again into our total care concept of managing the care for the Medicare Advantage patients. Our care managers would have access to the telemedicine portal, to the active remote monitoring, to the universal EHR, so that they can monitor the patients that they have responsibility for and ensure that if an episode, whether it's a cardiac or it's a blood glucose, a blood sugar episode, insulin episode, they catch that in time to prevent it from escalating into something even worse. And this can also be used and will be used in our Care Work Clinic, where we will have telemedicine rooms that can be used by a physician to consult with another physician, or even by a patient and a physician to consult with a specialist. So we're embodying all of this. All of this, you can see how all of this is interconnected, and that's why we call this our ecosystem in OXIO Health. So at this time, I'd like to turn the reins over to Gregg Steinberg, and Gregg is going to talk about the financials. Gregg?
Great, thank you, Carl. I appreciate that. So, if you think of it from a perspective of $8 million plus invested in power, as Carl was just chatting about, another significant amount of capital invested before we were spun out by our parent company in our patent and licensed IP portfolio of 21 issued patents and 19 pending. We've sort of been in a stealth mode, even though there's been significant resources and capital deployed already. As we come out of the hangar and out of the runway and get ready to take off, we need to obviously put some fuel in the tank. And so our view towards moving ahead with these 5 companies that Carl just went into some detail on, with the broad strategy that Noel discussed, is to put in place currently our current 7.5 million convertible bridge note that will allow us to get off the runway into the air, get the journey started before we move into our Series A raise. This convertible note, as I mentioned, is a $7.5 million note. It's a standard convertible note, which will convert at a 15% discount to our Series A. It's carrying an 8% premium, and it's a 2-year note. We expect to close this round over the next couple of months and move into our Series A raise immediately thereafter, so that we will be in our Series A raise mode in the fall, and this convertible note will convert into that once we have our first tranche of closings on that. In terms of the utilization of funds, you will see that that $7.5 million is really going to get allocated across all aspects of that org chart of the portfolios that Carl and Noel have shared a little bit earlier in this presentation. At the parent level, at the OXIO level, building the senior team and the support staff to handle all of the individual portfolio companies. And at the individual portfolio company, each of these have their own specific needs. Total care relative to identifying the practices, moving into discussions with those physicians, doing the due diligence, and getting LOIs in place so that once we have the Series A raised, we can move in swiftly to acquire these practices. Similarly with CareWorks, like those pictures that Carl showed in terms of those 4 buildings, the ability to do the initial due diligence, to look at locations, to look at the strategy behind that, and again, enter into discussions so that once the Series A is raised, we have the ability to move forward in terms of those acquisitions. And likewise, with the 3 technology companies, it's about building the team specifically in each of those companies, moving power into the MU3 certification, building telemed into these components, the blockchain component on the patient side, being able to integrate that effectively across all the platforms, as well as Blue Box as that integrates into the other 2 core components of the technology platform, as well as built into the practices that will be acquired under Total Care and within the infrastructure that CareWorks will be established underneath our portfolio. And of course, we need to maintain the licenses and the patent portfolio that we have and continue to move that forward. If you take a look at what this means in terms of revenue generation over the next 5 years, you can see that Total Care, which is the yellow line, is the core component. It's the engine, if you will, that drives this car. It's the anchor tenant in the CareWork clinics. Won't be the only tenant, but it's the anchor tenant. There'll be other physicians, other specialists, other support services that will take position in facility space within CareWorks, but Total Care, as you see, drives the entire car, that being the highest line. The next 2 core components are technologies. We build the technology component, the data component, and the ability to leverage both the telemedicine, power, blockchain, and Blue Box in terms of wearables. That blue line and the green line, as you can see, take a little bit of time to get started because you have the expense and the investment of building those technology platforms, but then swiftly become core components of the overall metric. And as Carl showed in one of the earlier slides with Medcare, this is not the first time that we are taking Total Care on this journey. We've done it before with Medcare, and so this, as you saw with that Medcare graph, the hockey stick is something that we've already accomplished and achieved. If you take a look at what this means from an overall perspective, you'll see that over the next 5 years, we're generating a company that will be delivering in excess of $1 billion worth of revenue at a 400 million plus EBITDA. The market is ready for what we are bringing in terms of this paradigm change. It's ripe for change. Consumers are adopting technology like they've never adopted it before. And because of the acceleration we've seen that Carl and Noel have spoken about in terms of COVID, the individual consumer is hungry for answers that are going to meet the coming lifestyle changes. Physicians are asking questions that don't have answers to them yet, that are going to be answered and delivered through the aggregation of our distributive venture platform, which Noel went into some detail on. Ultimately, it's about how we empower the patient, enable doctors, and advance the science. And we're going to invite you to along that journey with us to participate in this bridge note, as well as in the upcoming Series A. Of course, to execute all of this, it takes a team. So let me hand it back to Noel to share a little bit about how we're going to execute on this and what the future looks like. Noel?
Audio, Noel.
All righty, sorry about that. One of the things that we hope that you have heard and understood is that we've got the experience in every single one of the components that we have discussed here, literally in the physical operations, in the managing, consolidating of medical practices, aggregation of technology, innovation of technology, and actually seeing where the future is. This is almost like something that we prepared for our entire life. Beyond that, we have a tremendous amount of people that are sitting on the sidelines that have worked with me over the last three decades in healthcare. And the interesting thing is that the current COVID crisis has created even more instability. And I literally get calls every day about wanting to join the team, so that when we start this operation, we will be able to staff this entire company with all of its components in less than 60 days to set up, to acquire the practice, acquire the real estate, bring in the software development team that we have outsourced until now, and create this enterprise that we're building. And as I tried to say in the previous part of the presentation, the problem we have not been able to fix healthcare is because everyone's been looking at it as buckets. A perfect example that we've talked to investors in the past is no one looks at Federal Express, for example, as a store only. No one looks at it as a fleet of airplanes only. Nobody looks at a distribution center, a logistics center, a technology center, and a delivery. They had to build the entire platform to make it work. Well, that's the same analogy that could be used in healthcare. And that's why we have not witnessed a true healthcare revolution or a transformation for the last 30 or 40 years. It has basically been unchanged because there has not been a development company that owns its own practice operation. There has not been a practice operation that's owned a developing company, and all of the components related. That's why we see this as an opportunity to change healthcare. Exit strategy is always very important to investors. So the exit strategies are money. Certainly a spinoff of the individual companies, an acquisition, a sale, an M&A. SPACs are very popular recently. My favorite is always the IPO, only because it is incredibly important for the physicians to be incentivized and encourage their retention. After acquiring over 60 practices, it's something I've got a great deal of experience in. The industry is under tremendous stress, and that is an opportunity for us. You have physicians that are talking about literally closing their practice because they cannot function the way they are. You have real estate that's literally being dumped on the market because it cannot find tenants, and particularly retail, which is something we would be very interested in. And you have a number of people, both in technology companies as well in healthcare, that are looking for new opportunities. So this team can be assembled, will be assembled very fast. And it's something we also have a tremendous amount of experience in growing fast, dynamic companies. So our overall goal continues to be the same, and you cannot separate these. It is to empower the patient, engage the providers, and advancing the science of healthcare. So with that, we're open to any questions that you might have.
So a question from Chauncey, from Richard. Will our technologies be working in conjunction with Real ID Act regarding medical records? Noel, you want to take that one?
Sure. The unique thing about our technology is because we're developing it ourselves, it is designed to work with our patients. So we are going to control, think about the entire delivery system of our patients. So they will be our patients to start with. They will be our doctors. And so we're going to have a personal relationship with those patients and those doctors. As it continues to develop, we have 100% confidence it will be deployed in the marketplace. One of the challenges you have, for example, with telemedicine is that it is very easy to use if you're young and relatively healthy. It becomes materially more difficult as you advance in age and have more complexity. Let me give you an interesting statistics. Is 97% of people over 75 have returned to visit their doctors. And over 75% of people over 65 have returned to visit their doctors when you track patient volume. Obviously, it drops dramatically. In some cases, only 50% of the volume is important. So the important thing is to have that interaction with our patients and move forward so that we know the patient coming in so that we're able to provide care. Under that scenario, things like telemedicine and universal healthcare record are exponentially more valuable.
Great, thank you. And again, as Lindsay said, if you have any questions, please put them into the question box. Question relative to why now? You mentioned Amazon and Chase Berkshire Hathaway, et cetera. Why hasn't this been done before in terms of putting all these pieces together?
Well, that's a really good question, and probably my favorite question. And the reason why is go back and look at the Amazon example, and you can go back to our blogs when we published it. It's in our presentation. The blogs are all at oxiohealth.io, and basically what I said, they were not looking at owning their medical centers and the medical clinics. They were not looking at what's called industrialized medicine. They were not looking at negotiating with individual providers. At the end of the day, what's been public, if they've negotiated with insurance companies. So what they have basically done is a company that has hundreds of thousands of employees affiliated with another company with hundreds of thousands of employees, with another company, 100,000 employees. And out of 300 million, that's not, believe it or not, 1 million employees is not a lot unless they're concentrated. About 2 weeks after that blog that we talked about, the partnership between Berkshire, J.P. Morgan Chase, and Amazon, we noted a better example, which is one of Disney. Walt Disney World in Orlando created a scenario where they took all of their employees, which is about 50,000, in literally a 40-mile radius, and they split them into two. They gave one to one healthcare system and the other half to the other healthcare system. And over time, they will track whose system is more effective and more efficient. They have a better chance of changing healthcare in that environment, in that experiment, because they literally have a concentration of care. If they go one step further, which is to build their own delivery system, then you go exponential. So you've got three components. You have the payer who pays. In our case, we prefer the government payer. So that's Medicare and Medicaid. Second is the provider. How you provide the care is dramatically important. And third is the technology that brings it all together. You could not change healthcare unless you bring those three in alignment. It doesn't matter how great of technology you have if it's not optimizing the doctor, and it doesn't matter how big of an insurance company, it's really hard to change healthcare unless you're providing care. That's why one of the biggest trends, and in fact, the example we could use is one of the companies I found that was literally bought by an insurance company. So they brought together two of the components. The only thing they have not done yet is build a technology company. If that company either builds a technology company or buys a technology company, they would have sort of that perfect triumvirate to make it work. The reason why it hasn't happened is everyone's been looking at silos. Everyone is trying to create a faster delivery, to my example of Federal Express. Everyone's trying to create a better airline. Everyone's trying to create a better inventory and warehouse management. FedEx realized they had to control the experience end to end. And until a company like ours is created that will control the experience end to end, we are not going to fix healthcare.
Good, thank you. Question relative to the revenue. The revenue graph showed total care as the biggest component. Is that tied to capitation and the Medicare, Medicaid component that was in the other graph? Can you explain that?
Absolutely, 110%. So here is the way the industry works today. Medicare is literally the largest payer in the United States. They have about 33% nationally of their Medicare beneficiaries in managed care companies. And those are the companies that we would all know from all the Blue Cross and Blue Shield affiliates, the United Healthcare, the Aetna, the Cigna, the Humana, Coventry, and et cetera. So they receive a capitation from the federal government, a complex system that has to do with age, sex, complexity, and locality. Those companies generally, all of them contract with groups of providers, and they give them one of two payments. They either give them a primary care capitation, or they give them a global risk. I have been a part of companies, created companies that have been part of it. The big money comes when you're doing the global risk, because now you have an incentive to literally provide the best care. If you go back to our website and our blogs, literally wrote about that about 2 weeks ago, where I talked about the difference between primary care capitation and global risk capitation. Now, I will tell you, that is a thin margin business because it's healthcare. The reason we're going to make a difference is not only by providing the care ourselves, but also by using technology. We will be able to take those IoT devices that Carl talked about and literally hand them to the patient because we are going to know that we will get back our investment in better quality of care and lower utilization of costs. That is a really hard sell for IoT companies to go to healthcare companies and say, listen, buy our product or buy our service. It may or may not do it. We know it will make a difference. And here's that scenario. Once we prove with real analytical data, then we could take that technology and take it to other groups across the country that will also use that technology to optimize the patient quality, which is the only ways to increase profitability. I hope that answers the question.
We'll see if it does, if we get a follow-up. Question on competition. Who do you see as your competition? Either as a on the whole, obviously each of these individual companies have competition. So, but overall, how do you think about competition?
Well, my favorite answer for this is the truth, which is everyone is a competitor. The individual doctor, technically down the street, individual is a competitor because we're all buying for patients. Large doctor groups are competitors. Hospitals are competitors in multiple ways. One is they not only handle the patient admission, but many hospitals today employ doctors. The good news is that most hospitals do fee-for-service medicine. Some really smart, innovative hospitals happen to own their own insurance companies, and they have been sort of the leaders in the industry. In most cases, they are nonprofits. So they're competitors. Insurance companies can be competitors. I said, for example, Humana has one of the largest delivery networks in the country. United Healthcare has literally 30,000 doctors working for them. So in reality, they're all competitors. What makes us unique to them, to all of them, is we're bringing in our own technology layer and infrastructure. We're bringing our own innovations that I can tell you that as of today, none of those companies have. So in reality, everyone competes in healthcare against us. But we are bringing solutions to healthcare that none of those competitors have, either by the delivery system or by the technology.
Got it. Okay. And so a couple of questions relative to other models that are out there. So model seems to be the same as other entrepreneurial multi-specialty medical groups. What's the added value proposition you're bringing? And many sophisticated large medical groups negotiate contracts for real estate, technology, et cetera. So again, what's the value added that you're bringing?
Well, there's two questions there. First of all, we're not a multi-specialty medical group, period. Okay. Our primary focus is primary care, maybe expanded primary care. So we're not looking at creating a multi-specialty group. We find them very rewarding for the group. We don't find them rewarding when you're dealing with capitation and you're trying to act as a gatekeeper. So we're not now or intend to be a multi-specialty group. Yes, multi-specialty groups are negotiating. I can tell you, you certainly have the Epic, the Cerners, the Meditech, you have the Athena, you have eClinicalWorks, you have Modernizing Medicine. There are lots of companies in the technology field that these groups can negotiate with. That's not us. We actually own our own technology, and we're going to customize that technology on a real-time basis to optimize the best care to the patient, because that's how we are going to make money. So instead of going into one of these large companies and saying, we want to change this screen because we want to connect this platform, we're going to do anything else, you have two scenarios. One is you write a pretty hefty check for those technology companies to basically customize their existing platform to work to your needs. Or B, if it's a tiny change, you're going to be on a queue list, and when they do an upgrade in the future, they have enough requests, they're going to do it. That's the only two scenarios this works. We're going to work hand in hand. So as a technology needs to be enhanced and improved, whether it's a new device or a new way of seeing the patient or bringing in telemedicine or aggregating that home care, that distant care, we don't have to go into a queue. Yes, our development team can't do everything at the same time, but we will make a decision at a corporate level that says we want this that way. I am sure, though I've not seen, that companies like Federal Express and DHL do this all the time because, in fact, it is their technology. So no, we're not going to be a multi-specialty group because that's not where the money's made for our model. And B is we're not going to contract with technology companies. We are a technology company.
Fantastic. Thank you. So I think we're almost at the top of the hour. So we will be sending this presentation out and offering an opportunity to have one-on-one conversations. So we'll be connecting up with everybody shortly. I will wish everybody a happy 4th of July weekend. And Noel, I'll turn it over to you for a closing comment.
Well, thank you very much for all those attendees. We appreciate your time. It is an incredibly interesting, exciting time to be in healthcare. And I don't want to call this an opportunity company, but in fact, you could label it as an opportunity company because the opportunities are everywhere to use this situation to help transform healthcare and fix the healthcare system. It's going to happen over the next decade. My belief it's going to happen sooner rather than later because of what's happened with COVID and the challenges, as you saw in the slide, literally from the hospital to the providers. I think what was going to take 10 years may take 5, may take 2, may take 3 years, but it's going to happen now. Thank you again for your time. Back to you, Lindsay.
Thank you so much, gentlemen. And again, on behalf of everyone at Family Office Networks, we want to thank the OXIO Health team for joining us today and all of our attendees. As we mentioned already, we will be following up with everyone individually. So if you have any further questions, we would love to get you in contact with the team. We hope you have a great day and we look forward to speaking with you soon. Thank you so much.